most famous physical therapist on the internet.
Well, hi there, folks. I'm Bob Schroep, physical therapist.
Brad Heineck, physical
Together
therapist.
we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, Brad, we're going to talk about peroneal tendonitis. That's how I say it anyway.
Yeah.
I don't know, peroneal. Side of the foot pain, basically, the outside of the foot pain.
Right.
Causes and self-treatment. This is very timely, by the way, because my wife has been getting some pain there.
Yes.
And I never thought of peroneal tendonitis.
Wow, Bob. Well, actually, my sister-in-law is complaining about this. She says, what do I do? And I says, I got to do some homework. I haven't had anybody with this for quite some time. And this is for you, Chris. Going to show you everything, all the ins and outs about your pain and how you can correct it. So there you go. Just pay attention, though.
That's right.
The actual treatment,
Focus.
The treatment is at the end of the video, but we really want to make sure you understand it because it makes a big difference if you know what's going on and why it hurts.
And even how to treat it.
There you go.
By the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. And Chris, you can't sign up for this because you're a family member.
Oh, that's right.
But you others you can. You can go to bobandbrad.com, go to the giveaway section because we're always doing a giveaway. This week we're giving away a Thermotex far infrared heating system.
Yes.
This thing is awesome. This thing penetrates, the heat penetrates. I got to show this, Brad.
Oh, yes. Get the
It's upside
yardstick. Oh, it's upside down.
So this is normal, represents normal heat.
Skin deep, basically.
It only penetrates skin deep. Thermotex far infrared heating system. UV light, right? Not UV light. What am I? I'm talking about something else. This is infrared light. Penetrates 2.36 inches. So, got a difference.
All right.
All right. Go to bobandbrad.com or go to Bob and Brad on Facebook. With the contest, will be pinned to the top of the page. Instagram, Twitter, and TikTok if you want a 60-second version of our program. Let's go to work.
So, if anybody's still listening, we're going to go on with the show here.
All right.
So, the peroneal tendonitis. Pain on the side of the foot, but what is there? Why is there pain there? And there happens to be, I've got a little red mark here. We're going to show on Sam too. But where the red line is here, there's a tendon. Actually, there's two tendons, the peroneal muscles. Peroneal is a Latin word for side of the leg. That's how the name gets. So the muscle belly's up here, and that's what does the contraction, the work. But the tendon that offers the transfer of the force goes right underneath, behind the ankle bone, the lateral malleolus, and connects up right to the bone there. That's the brevis. The longest goes around and actually connects up by the big toe.
Gotcha.
The function of these muscles is to keep your ankle stable so it doesn't roll this way. So if you've had an ankle sprain, there's a good chance that you strained your peroneal tendons. If you had an ankle sprain and you recovered it and you didn't strengthen those muscles well, that could lead to peroneal tendonitis.
Gotcha.
As well as walking on uneven surfaces, overuse. Runners get this a lot, walking a lot. Walking on the side of a road that has a camber.
Sure.
And your
Slanted.
ankle wants to roll out that direction, stresses that tendon
with every
as well.
step, every running step, you're putting stress on that.
Right,
It's working to stabilize the ankle.
But wait, Bob, there's more.
All right, let's see more.
Let's look at Sam. Now, if you look
this is his left foot.
Yep. At the bony structure here, I've made his muscle green so it shows out better. But here you have, I just went one piece of tape because I didn't want to show both muscles. It's really not that important. But because the location is very similar, it goes around the back of the ankle bone, and that acts like a little pulley system, connects up to here, and it connects up to the bone that you feel from your little toe about halfway back your foot. So if we pull the tendon off, we're going to have a little rupture here. Whoops. Sorry, Sam. You can see right there, and there's actually called a Hageland's fracture. I believe I've got that right, where the bone here sometimes breaks right off. Now, I don't think you have that, Chris, because that'd be a little bit different symptoms. But again, stabilizing that ankle, we want to really look at that as part of our treatment. Keep that in mind. All right.
Thank you for the anatomy lesson, Brad.
Wow. Now, the other thing is sometimes the shoe, just the footwear, if the outside of your shoe is wore out, look at the bottom of the shoe, and if it's wore on the outside under there, if you get new shoes, could be a part of the problem, may even fix the problem. Sometimes they say really soft shoes allow the foot to roll. without you knowing about it can be part of the problem as well.
I think even tight shoes, Brad, too. If
Oh,
it rubs
yeah,
against
yep,
that tendon.
too tight in there.
Yeah,
So
and that's what my wife seems like what she was up against. She actually liked cushioned
sure,
shoes.
right.
The ones that were too hard gave too much
Right.
pressure against that area.
If you give different shoes and you notice one pair it's worse, that's an indication that you
Right.
got to get rid of those shoes. So treatment, how do we make it better, Bob?
How do we make it better, Brad?
Okay, Bob. Here's what we're going to, for some reason I keep thinking, oh, this is my sock. What we have here is if it's really sore and you get up and you walk and you limp and it's just tender to the touch and it's driving you crazy, you're just going to need to cool it down, get off of it.
You got to get it calmed down.
Right. Cold pack, a nice gel cold pack over that for 15 to 20 minutes is going to help. If you respond well to anti-inflammatories, ibuprofen, anything in the over the counter that works well for you, combine that with a cold pack and then staying off of it. Don't do the things that irritate it. I know sometimes you really cannot do that because you have to work.
You have to go on living.
Right, exactly.
But you certainly don't need to add to it. You don't need to
Right.
add your walks into it at this point.
One thing you can do, because one of the symptoms is pain with weight bearing, or if you've been sitting for a while and then you get up and walk, and those first steps you're walking and limping, and after you start walking a while, it's kind of like plantar fasciitis. It feels better.
Sure.
So before you get up, actually do some exercises. You can do ankle pumps, but for this, you're probably better off going right to left, like a windshield wiper.
Ins and outs, basically.
Yep. Ins and outs of the windshield wipers. Do that about 10 times, and that's going to help loosen up those tendons and those muscles. Okay.
Warm them up so they're ready for action.
Right. What did I say?
I said loosen up. That's fine too.
Oh, okay. Yeah. So warm, loosen.
Yeah.
Now, the next thing is the muscles up in here, and this is a really nice treatment. If it works really well, it's really fun because it's easy to do and it just is really effective. The muscles are up in here. If you start palpating or just push around, you got to go deep, and you may find a knot or a tender point, okay, a trigger point we call it. And once you find that, let's say I find one, I got a little one right there, and I don't have any symptoms, but usually you'll get, if you feel around in muscles, you'll find a trigger point. If this is associated with your lateral foot pain, it's probably going to be really tender and it's going to be tight.
Now, the muscle's been overworking.
Right.
You find that.
There you
You
go.
need to calm it down.
Right. The easiest way to do it is positional release. Strain,
We've
counter,
been having
strain.
good luck with this.
Right, exactly. Now, the best way to do this, we want to get this tendon and muscle on slack and take all the pressure off. The best way to do it, and I'm going to lay down because I think it's probably the best
lie
way.
down.
Lie down. So,
There you go.
yes, we do want to have, we're going to become English majors. You can do this on bed or the floor. And what we need to do is take the foot up and dorsiflex it, and I'm going to pull it this way to
Gotcha.
the right side. And you should have a pillow. I'm going to pull it up here.
And that puts that muscle on slack.
There you go, Bob. Exactly right. Now, with the other hand, I'm going to go to that trigger point. Can you see that, Mike? I'm going to palpate that before I do the treatment. Let's say, it hurts. That's up about a 7/10, 10 being the worst pain. And then I'm going to pull this over. Now, when you get your foot in the right position, you kind of have to wiggle it back and forth. Oh, thanks. Now I know he cares about me. Wow, what a guy. The position of the most comfort is where you're going to hold it. You're going to look at your cell phone or your clock, your watch on your hand, and for 90 seconds minimum, you're just going to hold it. You're going to sit there and relax, listen to the birds or the music or whatever you're going on, or just silence, and allow that muscle to relax. And that trigger point will relax, and circulation will become more prevalent there.
So if you can't see it from this angle, he's pulling this way is what he's doing.
Right.
Up and out that way.
Exactly. Thanks, Bob.
So,
After the 90 seconds, it's feeling good. You can go longer than 90 seconds. Just slowly let it back. You can wiggle it around a little bit slowly. Nothing happens fast after positional release. Then go back to that trigger point and palpate it. Chances are it's going to go from a 7/10, go down to a 1 or a 2/10. Then you know you've made some progress. It's going to feel better. And then
if that muscle's relaxed and it's not acting up on you, it's not going to pull on the tendon as much.
Right.
And the
Exactly.
tendon won't get as sore then.
Sure.
So it's just a good start to make sure that the muscle's not being part of the
Right.
culprit there.
And if you have success with that, you're going to do that 3 times a day. Probably within a
Sure.
couple of days, you're going to notice notable improvement. If that doesn't work, we're going to plan B.
Sure.
We're going to do a cross friction massage over that knot. So the fibers go up and down this way. We're going to go on there. Now, with my sister-in-law, Chris, I did this to her wrist once a long time ago.
Mhm.
And it was about 10 years ago, 15 years ago. I was a little rookie yet at the
Yeah.
time. She didn't respond to it. I think she got mad at me. So, Chris, if you don't remember it, just cancel that from your memory. So be careful when you do this. You get on that ropey spot and you go back and forth and you push in deep. Now I can feel my little ropey spot right there, and it's uncomfortable. And you do that, and after 20 to 30 seconds, if it doesn't clearly start feeling better, like, oh boy, that's better now, then you keep doing it. But if it's just feeling worse, then you stop.
Would you do cross fiber down here too, Matt? or
That's
not?
an option. You could go right down here on the tender spot and work the cross fiber over that. You're going to push in deep. Again, you're only going to do this is after 20 to 30 seconds. It clearly feels better. Sometimes if it feels numbish better, that's good. If it just feels better, that's good. You do it for a couple, 3 minutes until your fingers get sore. That can be a really quick way to get things moving in the right direction.
I would absolutely check that out as an option because I think that's what my wife's going to have to do.
Sure.
I think that's the one because the irritation is down here. I think there might be some micro tears down there.
Sure. Yeah.
And that's where we want to treat. So both areas you want to check out.
Right. Again, these should feel good when you're done and as you're doing them, or like I said, into it with the cross friction massage. Now, we've got one more thing is to strengthen the
Yes.
tendon or the muscle. So there's some really nice ways to do this that you don't have to buy any special equipment or whatever. Okay. I need to stand up.
Oh, sure.
So I call this the ziggy zaggy. It's a nice way to strengthen your ankle muscles. Typically, I'd have shoes on. I'm not going to go put my shoes on for this. It's the same motion. We're going to go like this and like this. And when you do this, your lateral muscles or the muscles on the sides of your ankles are working quite aggressively, particularly
They're
when
working hard.
Yep. When you have shoes on that grips and offers better resistance. And you just go back and forth like this until you get fatigued. Usually it's back and forth 3 or 4
You can
times.
play a little music if you need to.
Yeah,
Sure.
music. Now,
But the thing is, don't expect results from this like in 1 week even. You're going to have to do this for a couple weeks before it starts
Yeah.
to get stronger and you'll notice the difference.
exactly. Do it once or twice a day. Get to the
Yeah.
point of fatigue and then let them rest. If it hurts and creates pain and it's setting you backwards, you got to stop. It's
Yeah,
not,
right,
It's not
right.
ready for it yet.
This is something that needs to be done once the foot is ready for it.
Right. When it's feeling better, you're not
Right.
experiencing that sharp pain. No more ice pack, no more ibuprofen. The tender spots are gone or pretty close to it.
Well, show the one you can do just sitting down, Brett.
This is a nice one. Say this is the side I want to strengthen. My right leg. You take your other foot, go over the top, and you offer resistance with your blue sock. So you have to put a blue sock on, Chris. I'm just kidding. It works good for instruction. So I'm pushing outwards with my sore or the injured foot, and I'm using this foot. All you have to do is relax this foot, and it really works like a nice resistance, doesn't it,
Right.
Bob?
So basically, you're going to push out. You're not going to allow the resistance, or you're going to give some resistance isotonically, Brett. Is that what you're doing?
Well, actually, I'm just relaxing my foot here in it because I'm stretching. I'm actually stretching my left foot.
Sure.
And I'm pushing out.
I mean, you could do it isometrically where you don't even allow it
I
to
see.
move.
Yeah, right. Yeah. Oh, but I think you're better
You're
off.
better
doing
off.
it-
Yeah, I think so too.
Right.
You get some motion along
Yeah.
with it. So it's giving some resistance. It's like if I was resisting to my bicep, I'd be going like this.
Right.
I'm
Oh, Bob is
stopping it.
strong
Yeah.
like bull. But yeah, so I'm offering resistance that's moving. I'm not trying to do an isometric.
Sure.
You
Gotcha.
could do an isometric if you'd like. I think you'd be better
I
off.
was surprised how well this works, Brad.
Yeah,
This is actually
it really is.
really a simple thing that you can do at your desk. And like I said, do that for a couple of weeks and you're going to notice
Right.
a difference. The ankle's going to be more stable and less likely to injure itself.
Exactly. So, you've got, I would say, 10 to 15 reps, 2 or 3 times a day. So very good. I hope anybody who has their peroneal side of the foot tendonitis pain, this is going to help you out and get you back on your feet again.
All right. Good
No
luck
pun
out there.
intended.